when I just kind of support it like that, what does it feel like?
Fine.
Okay.
No problem.
Let this come in here. So usually what I'll do, just so you know, is I'll kind of pinch the foot between my shins so I can kind of lift and give you some support. And then as I come in here, when I pull toward me, it should be comfortable. It shouldn't be. And so what that does, and this is what I was saying, the motion is in the joint, it's just the swelling that blocks it. So as long as I can kind of glide the lower leg bone, the tibia forward, you'll have extension. As long as I can glide the tibia back, you'll have flexion. And so as long as we keep that joint inside mobile, we don't actually have to bend or straighten the knee very much to maintain the range that, you know, we've got. And we just let the swelling kind of go away.
Okay.
But since you do have such good range, let's take advantage. And so go ahead and let it bend.
Yeah.
That's it. And then let it relax. And then bend. And relax. What does it feel like when I'm lifting behind the knee?
It's just sore.
Yeah.
But it's had a lot of trauma.
And that's the thing. This kind of creates like a counter pressure
Yeah.
back there.
Actually, that's what I've been doing at home.
Uh-huh.
Is pushing upward and inward.
Yeah.
It seems
Perfect.
like it relates. It stops that spasm.
Right. That's what it. You know, because when you're trying to bend, the pressure is pushing out the front. That's what you feel like it wants to open that up. So if I can create some sort of counter pressure behind it, it'll kind of that's why the wrap works so well,
Yeah.
because it just gives you some counter pressure.
So it's okay to put pressure. I can use the ACE bandage at like 50% stretch.
Yeah.
Okay.
Absolutely.
I'll do that now. Because before we were just wrapping the bottom at 50, nothing over the knee.
Uh-huh.
Okay.
No, yeah, you can do the whole thing.
Okay.
Let's try one more little setup. Sit back and relax. Stay right there. Don't run off.